Blood clots, cancer and you. What you need to know. A cancer diagnosis can be difficult for anyone. There's so much to think about. All your treatment options, planning for the future, talking to family and friends. And for everyone, there can be complications along the way. One of these complications is blood clots. Clots are serious. They form when blood cells stick together, blocking blood vessels. They usually form in the legs as deep vein thrombosis, known as DVTs. However, if they move to the lungs, known as a pulmonary embolus or PE, they can be fatal. Anyone could develop a clot, but some factors put people at higher risk. And it's not just after long plane journeys. For example, people with cancer are at greater risk of developing clots. This is known as cancer-associated thrombosis, or CAT for short. It is possible that up to 1 in 5 people with cancer will experience a clot. And CAT is a major cause of death for cancer patients. Despite this, the risk of clots in cancer is not commonly discussed. However, there are effective medicines which can treat or help prevent further clots. Some cancers have a greater risk of cancer-associated thrombosis. Being treated for cancer, being inactive in hospital, and having surgery can also raise the risk of cancer-associated thrombosis. Your healthcare team should talk to you about clots and regularly review your risk throughout your treatment. Feel free to ask if this hasn't happened. It is important to keep an eye out for symptoms of clots. Signs you may have a DVT include swelling or pain in the leg, usually in the calf, warmth and redness of the skin, particularly at the back of the leg, below the knee, or for a clot in your lungs, or PE. Symptoms may include lightheadedness or feeling faint, unexplained shortness of breath, chest pain, particularly when breathing deeply, and coughing up blood. If you are worried about clots, contact your healthcare team on the number you have been given. You may not have any symptoms, so it's important to reduce your overall risk of CAT. Keep moving. Try to exercise gently and as often as possible. This can include light exercise, such as a little gardening, walking to the shops, golf, or even housework. Remember to change position and move your legs regularly if you are sitting or lying down for a long period. Quitting smoking can also help to reduce your risk of clots. Your healthcare team can help and give you support should you wish to quit. Also, try to drink plenty of fluids, but avoiding coffee or alcohol where possible. The recommended treatment for CAT is a daily injected dose of anticoagulant, low molecular weight heparin for at least 6 months. An anticoagulant is a medicine which makes the blood less likely to form clots. When used as treatment for a clot, anticoagulants, such as low molecular weight heparin, can stop clots getting bigger, so your body can break them down and help prevent new clots forming. Low molecular weight heparins are easy to use. Your healthcare team can teach you or a family member to give the injection at home. A cancer diagnosis is difficult for anyone. There's so much to think about, but try to be clot aware. With the right information, support and response, cancer-associated thrombosis can be treated and further clots prevented. Don't forget to ask about clots and cancer-associated thrombosis.